Hi everyone, my name is Trevor and this is Dr. Peter Yoo, aka the Tooth Doctor. And today we're going to be talking about how do I make sure that my child won't be afraid of the dentist. Here's a quote from Taylor Caldwell. I was never afraid of anything in the world except the dentist. I don't know if you guys can relate, but surveys indicate that between 5% and 6% of the population and 16% of school-age children have a fear of the dentist. So Peter, with that, give us a little bit of backstory on how you deal with this situation.
You know what? I like seeing kids, and a big reason for that is because I've seen a lot of adults that have had bad experiences. I used to work with a dentist who did sedation, and so you see a lot of nervous patients. And I met a patient, big guy. He actually was an MMA fighter. Okay. So he's not afraid of getting a broken nose, but when he's sitting in the dental chair, he almost broke the arm of the chair while waiting for me to come in just to do a checkup. So, yeah, it's unfortunate to see things like that. See someone who's like a senior lady, like 65, 70 years old, and she's just nervous, like white knuckled, and I'm just like, I didn't even see you yet. I didn't even say hi. So yeah, and that's where it all begins is from childhood. So that's where I am concerned, and we want to try and change that, so that people do have start. It's about starting off with a positive experience. So
awesome. Yeah. I couldn't agree more. So how often do you have school-age children come to you that are really afraid of the dentist?
We don't get, we get, here and there. It's not a ton. Most kids, they come in, they know they're going to get a checkup and get their teeth cleaned and stuff like that. But we've had some kids where it's like every little thing, I lift my finger like, what? And I'm like, okay, so that child, we had to kind of explain each tool, show them each thing. Before we put anything in their mouth, just to have a look, we'd always show it them, tell them what it is, and with that, it kind of provided a little bit of ease of heart.
Nice. I had the same problem with my son. He was afraid of the dentist, and I didn't know why. So what do you think causes this fear of the dentist?
TV shows. Starting off, you see all those TV shows, and obviously it's for comedy, but first thing, and when kids are young, they have to get those vaccines and flu shots, right?
Right. Yeah.
So when they get those flu shots, like the nurses, they want to get it done quick. And I love nurses and everything, and I know they're doing the job, but when a kid comes in and it's quickly, they poke them, it hurts.
Yeah.
Yeah, right? And so when they come to the dentist and they hear, oh, they're gonna get a poke, they kind of relate it to, their vaccinations and flu shots, right? So that's kind of also what I've seen and experienced, with my kids as well. So.
Okay, so what can parents do to help their children to not develop this fear of the dentist?
Just being positive, not making it seem like, oh, it's a punishment. We're taking you to the dentist because you are bad. Trying to have a good experience. Say, hey, we're gonna come, we're gonna look your teeth. Just communicating with them, helping to understand, and also. As parents, it's important to make sure that the kids are listening to you, right? Because when the kids listen to you, then they're gonna follow. There's some kids that they just do whatever they want, and those are the ones where I find it's more difficult.
Right.
So having good control and just giving them peace, of comfort, and trust, I think that's very important. So that kids come in, when we're looking at their teeth. Kids will look. They'll always look at their parents. Is everything okay? Kind of get that sign of reassurance. That's very important.
Okay. So besides those things, is there anything that parents can do to help their children with that first visit or to allay those fears?
Allay those fears. Yeah, just explain kind of an idea of what's going to happen, but also, making sure that their kids come in early, right? So many parents think, oh, let's do this, and I know life is busy, you got so many things, but to wait till their kids faces swollen like a baseball, or they look in their mouth, it's like there's all these, why is their tooth black? That's not good. I had this little girl, She had baby bottle caries, right? Drinking milk while she goes to bed. She loved milk. Mom couldn't let her. And, wait, all 4 of her front teeth were black. And it's like, oh, that doesn't look good. Yeah, we should go see the dentist. Well, kind of late. So, come in when they have good teeth. Sometimes, the association says when your first tooth comes in, then that's when you should see the dentist. I kind of feel like it's a little early. I would say, when they're around 2 or 3, when they got good teeth, they got a lot of their teeth come in, because we don't just want to talk about cavities.
Right.
We want to talk about development, right? There are things that you can do to make the kids grow, okay? Not grow, but develop properly, right?
Okay.
So many kids, parents think, oh, genetics. My kids I have crooked teeth, my husband has crooked teeth, or my wife has crooked teeth, and so my kids are going to have crooked teeth. And that's not true. Most kids, when they come in, you can do things, and as a dentist, we can give you guidelines and tips about what to do to help your child develop properly, their teeth come in nicely, and just little tips about, just even cleaning that will just make it a lot easier and more efficient.
Nice. Okay. Now, for tough cases, is it always recommended that kids go see a pediatric specialist? Is that something that parents should always do as a first resort?
Well, you know what? If you have like a pain in your heart, you just automatically call the surgeon, right? Like you have to go see your family doctor, see what's going on. Maybe it's a hiccup. Maybe you had some gas. Like you go in and check and assess, and they'll refer you. Okay, and that's what I recommend to parents is, hey, bring your kids to the general dentist.
Yeah.
Let's have a look. Hey, if there's a difficult case, there are dentists out there that, they can, treat young kids, with certain, like sedation, things like that.
Right.
And but when it's a tough case, that's when we do want the specialists. They do know how to take care of young kids, putting them under and getting them all treated well. But coming to see a dentist, sometimes I pulled a tooth out on a little kid that was 3 years old.
Wow.
And they were really good. So you got some really, really good kids. Hey, do they need to see the specialist? Sometimes they don't. Yeah.
Okay. Now, let's say parents have gone down the road and they've seen a specialist, and is it okay for them to get a second opinion because of cost or other factors?
You know what? I think that there are always multiple factors when you go anywhere, right? As much as you like places, there's sometimes location, sometimes a fee, sometimes just the patient comfort, right? Sometimes just scheduling. I know a lot of specialists, they do good work, but they're busy. You want to get in, they're booked 6 months down the road. Right? And same as certain dentists too, right? So a lot of it is just kind of where you're at and where your comfort is. So, we've seen kids for second opinions, just to get an idea. And you see some kids, they have a lot of work to do. I've seen kids where it was tough. I tried to help them. I tried to explain things to the little kids, and unfortunately, they're just too difficult, and we've had to send them to a specialist.
Okay.
Right? On the flip side, I've seen kids, they've got like 10 cavities, but they come in, we do one, it goes well, and it's like, oh, next appointment, we do 2. Oh, goes well, next appointment, we do 3. And then we get all their teeth fixed and not have to be putting them under. And, sometimes it does help in terms of savings. So
Nice. Question for you. Let's say a child comes to a dentist and it's their first visit. What is something that a dentist can do to help a child get dental work done? What do you do in that first appointment?
Well, for us, we always try and make our first appointment just easy. Okay. Bring him in, sit him in the chair, go for a ride up, go for a ride down. Okay.
I like
Lie
that
him
too.
back. Yeah. We have TVs, so they come in, the TV's over their heads, and they can watch some TV. And and then we just go in, we count their teeth. Yeah. So, if they're good, they open their mouth, great. If they're willing to let us try, sometimes we try and go in, we just try and clean their teeth.
Okay.
And so that's the first appointment. Just make it good, make it short. Right, and so they go home with a good feeling. They get a little prize. They'll get maybe a little sucker or something, lollipop, and then yeah, and then they come back and they want to come back for a second appointment. And then you go in and try and do certain things, right? You don't want to have kids coming in the first appointment. It's like, oh, we got to pull this tooth out, you know?
That'd be a bit extreme.
It sometimes happens, so yeah.
So that is how you get them comfortable with some of the tools and some of the things that you do, the procedures.
Yeah.
Now, what steps can a dentist take to have a child allow them to give them the freezing needle?
Okay. Well, first of all, I don't use the N-word. Okay? In our office, that's like a swear. And so with young kids, I worked in an office, and I had this assistant working with me, and she goes up. We had a little girl, I had to give her freezing, and she goes, "It's okay, sweetie. It's just a little needle." And you know, as much as you want to say it's small or whatever, once kids hear that word, they're sometimes out the window. So we try and use different words to explain what we're doing, as well as, you know, when we go in, we try and be very clear. This is what we want to do to make it nice and easy and comfortable. And we explain. We don't hide anything. You know, we tell them you're going to feel a little poke. You know, it's going to be okay. This is going to happen, and then they feel a little bit more at ease, right?
Awesome.
Yeah.
Now, why is it so important for children to overcome their fear of the dentist?
You know what? I've met some patients, and they come in and they have broken teeth. They have these, you know, 4 or 5 teeth that are infected. It's sad when you hear people. It's like, how come you didn't come in sooner? You know what? It didn't hurt me enough to come see you guys. You know, that's very sad. You know, and you know, they say that your mouth is kind of the start of your health, right?
Right.
Maybe it's the food you eat, but you know, the different diseases and bacteria in your mouth can spread into your body, and there is correlation of, you know, gum, bone health, teeth health to heart disease, diabetes, things like that. So, you know, it's very important to stay healthy. I've seen some young people where, yeah, they're afraid of the dentist, and I even had to, you know, pull out all of someone's teeth before they were 30 because they're afraid of the dentist, and that's very unfortunate.
Absolutely. Well, thank you so much, Dr. Yoo. I appreciate the time you spent with us, and if you guys have liked this and enjoyed, please subscribe to the channel, and always check out thetooth.doctor.ca for more information on how you can make your oral health better.
Thank you.